watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can make a big difference. With us, we have an expert on the topic, Dr. Ferguson. Dr. Ferguson, welcome to the program.
Thank you for having me, Randy.
All right, now before we get into today's topic, now you brought a lot of photos.
I did.
Now, you are a dentist and you say that the smile is pretty important. How important is the smile?
Smile is extremely important. I mean, it's immediately what everyone looks at. Before you even look at the color of the eyes, you look at a person's smile. If the smile isn't centered and beautiful, people just won't pay attention to you.
Have you always had a nice smile, by the way? That's just a naturally good smile?
It's a naturally good smile.
Okay,
Thanks
good.
to my parents' DNA. Yes.
All right, all right. And interesting too, by the way, you wanted to be a dentist since you were 17 years old. I guess you were in high school, because you don't look like a dentist. Did people tell you that, right?
No, not at all.
They
not
never
at
tell
all.
you?
No.
Okay, okay. No, but you knew when you were in high school that you wanted to be a dentist?
Yes, yes, very much so. I was fortunate enough to be able to have worked in the hospital for a period of time. I thought I wanted to be a physician, but after being in the hospital, I decided that just wasn't my cup of tea, so I chose dentistry.
Okay, good. Now, you say you're changing people's lives. You change their smiles, you can change their lives.
Yes.
Elaborate on that.
Sometimes we have patients that come in that aren't outgoing, they're kind of quiet, they're timid. You know, you ask them a question and they give you a one answer or one word response.
Is that right?
Yes, one word response. So they're just not very outgoing at all. By the time we finish with them, they're very outgoing, they're open, they're smiling. You know, they walk through the door smiling.
Now, you know, this particular segment, we're talking about cosmetic dentistry. But you say small improvements can make a big difference. What are the categories that fall into cosmetic dentistry, as you see it?
There's various categories that fall into cosmetic dentistry. I mean, literally, it's all phases of dentistry that affect cosmetic dentistry aspect. So you have the veneers, you have bleaching, you have orthodontic treatment, which is the movement of teeth to correct any misaligned teeth or crooked teeth. We can straighten, close gaps, improve the smile so everything looks symmetrical and even. There's also veneers, which are coverings or thin coverings that go over the teeth to correct any gaps or spaces as well. There's also crown and bridge. There's implants to replace missing teeth. We can even correct gummy smiles by using a laser treatment to reshape the gum tissues so that you see more tooth structure instead of the gum tissues.
So what is your role in the practice, by the way?
My role in the practice is literally to give the patient back their smile. My partner, Dr. Yetta McCollum, is a periodontist, so she kind of lays the foundation. She helps to make sure that the bone support and the gum tissue are where it needs to be to put all these veneers, crowns, and bridges and bleaching prior to doing that. Dr. Cornell McCollum is our oral surgeon, so he takes care of any surgery needs that a patient may have, from placing the implant to extracting any wisdom teeth, anything that needs to be done to prepare the patient for that
And you're in the
stay.
Chicago Dream Team, is that right? That's what you call yourselves? And I've met them. They've been on my show. I mean, none of you look or act like dentists, or at least what I think of as a dentist. I mean, very down to earth, very humble, very nice people. But do you get people still that say, I don't like coming to the dentist? No offense, doctor.
Oh, all the time.
Really?
You know, they come through the door. We usually have patients fill out a questionnaire. And the top of the question on the questionnaire is, why have you not been to a dentist? Or what is your reasoning for coming in? And they'll say, well, we want to fix our mouth, but doc, I'm afraid, I'm terrified, I'm just scared to death to get in your chair. Nothing against you personally, but I'd rather not be here.
Okay, okay, good. Okay, do you get people that are afraid of the dentist or don't like the dentist that after a while they start looking forward to going to your office?
Oh, most definitely.
Really? Really?
Well, what usually happens is we try to make the patient comfortable initially when they come in. We put them at ease. We explain to them what we're going to do. We show them before and after pictures. We show them cases so that they can feel that they're not alone, that they're really, you know, this is a normal thing for patients to feel this way, and we try to make them at ease.
Now, you brought some photos of some of your smile makeovers, I guess.
I did. This patient is Deborah. She came in to see me, and she just didn't like her picture at all when she smiled for photos. She covered her mouth all the time. She was just really unhappy about her smile. And
even to the dentist, they'll walk in and cover their mouth a little bit?
They'll completely cover their mouth. They'll speak to you with the mouth covered because sometimes they know that their breath is offensive because of the bad odor and smell from the periodontal disease. And they're just not comfortable. They'll hold their heads down. You know, you tell them to look up and smile, and they'll respond to you by saying, I don't want to smile at all. It's horrible.
Okay.
So this is one of those patients. This is Deborah. When she came in to see me, she said, you know, I've really neglected my mouth for years, and I know that I have to do something different. I realize that my insurance just isn't going to cover everything, and I know I have to spend the time and the money to get my mouth corrected, and that's why I'm here. Okay. So when you look at Deborah's photo, you can see that in her smile, there's nothing symmetrical. And when you look at a face, when you look at stars or you look at the glamorous people, everything in their face is symmetrical, from their eyes to their eyebrows, to their nose, to their teeth. Everything is uniform because harmony represents beauty. So Deborah noticed that, you know, everything was okay except for these teeth. You know, one tooth was longer, there was spacing here, one tooth looked bigger, and she was just not happy at all with her smile.
So when you look at that, what are you thinking? What do you do?
When I look at that, I completely look at it and I say, I can fix this. I can transform your smile.
Really?
I can get you comfortable to where you're smiling and you're happy. And you don't want to do anything but smile. You're just comfortable with everything. So I think for Deborah, her biggest concern was how quickly we could get treatment done, what treatment needed to be done. And she was basically open to anything. She's in her late 40s, and I think when I started to go over her treatment and the type of treatment she needed to have, I started off by suggesting that she have orthodontic treatment. And I think her first response to orthodontic treatment was, I'm 40 plus years old. I don't need to go into braces at 40.
Yeah.
And I said, Deborah, in order to change your smile and make it the least invasive, meaning the least tooth structure removal, we really need to use braces. So for Deborah, we did fast ortho, and fast ortho consists of having a gum surgery to prepare the bone to move the teeth rapidly, and placing the brackets and wires on and having that movement completed within a 4 to 6 month period.
4 months, is that right?
Yes.
Okay.
Yes. You know, really within 2 weeks of having the surgery and the placement of the brackets on, the patient actually can see a difference in their smile.
All right.
The other concern that Deborah had too is the tooth in the front, dead center, was a tooth that she was going to lose. And so she didn't want to go without a missing tooth at all. And I reassured her that during the ortho process, she would have an artificial tooth there, so she could continue to smile and be comfortable with her smile and not have to worry about missing a tooth. Just about when she was finished with ortho, we were able to place the implant in that space.
So a dental implant? Okay.
Dental implant in that space. Because from the ortho, we were able to prepare that bone for that placement of that implant. So that saved her a huge, long series of surgeries to get that bone ready. So she had the implant placed. By the time she came out of ortho, we were able to put that crown over that implant, and she was completed.
Okay, let's take a look at that after.
And this is her after picture.
Very nice. Put those side by side. It's very nice.
Randy, look at the difference between these two photos.
Nice.
She looks at least 10 years younger.
That's true.
She's changed her hairstyle. She got rid of her glasses. She just really looks jazzy, and she's very happy. I mean, you can just see that it's almost like she has a little twinkle in her eye from her smiling.
That's right, that's right. You know, we were talking off camera a little bit about that in this economy, that when you have more confidence on a job interview, things like that. When I look at that, you can't help but notice if those two people, even though it's the same person,
correct,
one's smiling, one isn't.
Correct.
Who do you hire? Like
well, you definitely hire this one.
Okay. All right.
Yes,
and when it's all done, what does she say?
Oh, she's just ecstatic. She's referred several patients into the office as well because they cannot believe the transformation she went through. They can't believe that she didn't have a lot of work done, a lot of crowns and veneers, where ortho allowed her to move her teeth, close those spaces, and minimally do any type of tooth reduction, which helps her to hold on to her teeth longer because the teeth haven't been touched. They're still virgin teeth.
Is this one of those things where she says, I should have done this, Dr. Ferguson, years ago?
Yes, she definitely says that. When she says that, she always clarifies it and said, well, I may not have gotten the same result had I gotten it done years ago, but I'm happy I got it done today.
Good. You have more photos. What are we looking at over here?
I do. The next photo is of a patient, Mary. Mary is in her late 80s. And
right?
And Mary was very frustrated. You can see here she's just not smiling. She refuses to smile. She's really a very personable, giving, kind.
You said that is her smile.
That is her smile.
Mouth closed. Okay.
That is her smile with her mouth closed. She just hates the way her mouth looks. And Mary's other biggest concern is because she is getting up in age, what can she do to correct it? You know, she always says, many things are going on with my body. My knees are failing, my hips are failing, at least I can get my mouth corrected.
All right.
So she was real concerned about eating and the ability to eat properly. She said she wasn't chewing her food properly. She was starting to have issues with her stomach. And she said she just needed to do something different. So for Mary, the best solution for her, because she had advanced gum disease, her gums would bleed, her teeth were moving, they were shifting, her partials weren't fitting, her partials would slip out while she was eating or talking. She's just really uncomfortable with everything. And after examining Mary, we determined that the best solution for her, because she had so much decay as well, is that we completely restore her mouth with implants. And so that's what we did. We made it very simple. We placed 4 implants on the upper arch and 4 implants on the bottom arch.
So they get a full arch of teeth, a full set of teeth.
She gets a complete set of teeth.
Okay.
And she went through the surgery beautifully, even though she's about 85, 86 years old.
Right?
Yes.
And she could eat and chew and...
She could eat and chew immediately.
All right.
This procedure is what we call teeth in a day. There is some preparation work prior to that. They just don't walk in the office and you get those teeth on that same day. There is preparation work prior to that. But the day of the surgery, the day that she had her teeth removed, the implants were placed. Her upper and lower dentures or prostheses were placed in her mouth.
Snapping right in. Okay.
Well, hers screwed in.
All right.
So they never would come out at all. I could be the only person that would take them out, but she couldn't. Easy to clean, and she was able to go home and eat soft foods that night.
Let's take a look at that after. Very nice.
Here is her after picture.
She doesn't look 80-something years old, actually.
No,
and
she's in her late 80s, and you can see here she's not smiling on that before picture, but she is smiling on that after picture. So she's very happy, and most importantly for her, looks was a priority. Her appearance was a priority, but her biggest concern was being able to function.
So eating and chewing.
Eating, chewing.
So she could eat like a steak or
she can eat
an
a
apple,
steak,
corn on the cob, or whatever.
Corn on the cob, an apple, anything. Yes. This is Miss Hattie, and Miss Hattie was
Is that common to see that, by the way?
It is common. It's very common in my practice. There's a lot of patients that come in with worn teeth, discolored teeth, broken teeth, old fillings. You know, my practice has a high amount of silver fillings and just worn out teeth.
Okay.
So I have a really good time when a patient comes in and they look like this and we transform them completely.
Really?
Yes.
Really? Now, I use the word smile makeover. What do you guys call it? Like when you transform a smile?
Smile makeover.
Smile makeover? Okay. So that's her after.
So this is her after.
That's very nice.
And she's just thrilled.
Okay.
She is thrilled. In fact, she's dating again where she wasn't dating before, and she's just a happy camper now.
Now, when they look at the mirror, we've talked on the phone, and see their teeth for the first time, does it get emotional for them?
A lot of patients, it becomes very emotional. They're just, it may not be in the final product that they get, but that initial temporary, when I transform them from looking like this to having temporaries that are basically in the same shape that the permanents are in, they're thrilled. Sometimes they cry. I can remember having a patient that was in her 70s that was just very, very concerned about her appearance. Her whole face was changing. Her whole face was disfiguring. And when we were done placing those implants and putting in her temporaries, I mean, she cried. She got on the phone and she called her son, and she was just ecstatic because it restored her face again.
Now, we are just about out of time, so we have time for maybe one more photo.
Time for 2 more?
2 more,
Randy?
okay, 2 more.
Okay, great. This is another patient, Rita. Rita came into the office. She was looking to improve her smile. She wasn't happy with her smile at all. In fact, she really felt that it was holding her back from getting a job promotion.
Really?
And so a lot of patients don't realize that how much the smile affects them in their job employment, getting promotions within their job. If they're not smiling, if they're walking around looking unhappy all the time.
That's a good point.
An employer doesn't want to have an unhappy person working in customer service. So her job required that she face the public on a daily basis, and she really felt that the way her smile wasn't allowing her to be promoted. So this is Rita afterwards.
Very nice.
And you can just look at the difference
doesn't
here.
Look
she
like
really
the same person.
Doesn't look like the same person. She's
there's almost a credibility too. When I look at the before and after, she almost looks more sophisticated, I guess, for lack of a better word. I mean, really.
Well, I think the self-esteem just goes up tremendously. I mean, she's comfortable with herself. She's happy again.
Yeah, very positive.
Very
Look.
positive. And the good news with Rita is she did get that promotion about 5 weeks after.
Because of her teeth.
Because of her teeth.
Because of her teeth. Well, okay.
Because of her teeth.
Good.
So.
Good. Now, men, and I know you have a photo of a man.
I
Is
do.
it 50-50 men? I mean, more women?
No,
do
it's
this?
about 50-50.
Is it really?
Yeah, usually if there's a significant other or a wife, usually the wife will send in the husband first.
They
and
drag
then
them in? Because men wait for the last minute, right?
Men wait till the last minute.
Okay.
They usually wait until they're in pain to come in.
Okay.
So, this gentleman is a professional. He's a psychiatrist, and it's very interesting that after we completed his treatment that he said, you know, my patients used to think that I was just this angry, miserable, mean person, and I'm really not, but I just didn't smile. And you can tell here that his teeth are worn, they're dark, they're yellow. You can barely see the edges of the teeth, and he really had to grimace here to show any tooth structure at all. And if you look at his after picture,
Very nice.
it's just wonderful. It's just wonderful.
So
it's
when
youthful.
it's all done, I mean, this you say he's a professional, he's a psychiatrist?
Yes.
Is that right?
Yes.
And why did he do it? I mean, what's the tipping point? I mean, what gets them to finally say, you know what, I'm going to do something about my smile?
Well, I think with a lot of patients, you know, it's like one day they wake up, they look in the mirror, and they say, who is this in this mirror? You know,
Okay.
This can't be me, you know, or they have a revelation that I'm getting older, I need to do something to improve my appearance. I may not be able to get rid of all the wrinkles and the lines that are coming in, but I could do something to improve my smile. So a beautiful smile can really take 10 years off of your appearance.
Yeah, I think it's pretty obvious. Well, thank you for coming on the show. Great information. Good stuff.
Thank you, Andy.
And all of these photos are on your website?
All
that
of these
right?
photos are on our website, including information
And
about all the procedures.
the consultation costs nothing if they want to go in and talk to Dr. Ferguson?
Correct, correct. The initial consultation.
So
is
if you
free.
don't like your smile, what's your message? Somebody watching this, what do you say to them? They're miserable, they don't like their smile. They're afraid of the dentist, maybe, afraid of pain. What do you say to them?
What I usually tell them is they should come in for that free consult. It's painless, it's costless. It doesn't cost anything to sit down and talk and learn about what could be done to improve your smile.
Great, good stuff. Thanks so much. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, oral surgeon, Dr. Cornell McCullum. Dr. McCullum, welcome to the program.
Thank you very much. It's a pleasure to be here.
So let's begin then with who's a candidate for dental implants and what are the different categories of patients that you see that come in for dental implants?
I'd categorize patients as single teeth implant patients, multiple missing teeth implant patients, patients who have been told they're going to lose one or multiple teeth, denture wearer patients who have been wearing dentures for just a few years,
Okay.
and also denture wearing patients who have been wearing dentures for 30 or 40 years. They've been missing their teeth a long time.
Okay, now what are the age ranges of patients that are coming in? I mean, the youngest to the oldest that you've...
That I've seen?
Yeah.
I would say the youngest probably around the age of 17 up to actually 90 years of age.
90 years old. And so they won't fall out. I mean, at 90 years old, I mean, the people that you've treated.
Correct. Will the patient actually fall out?
No, I mean, will the implant fall out?
Implant? No, it won't. Their healing is actually pretty much on the same level as anyone younger than them. So same as patients who are 30, 40, 50 years of age, their healing is just
Sounds
as well.
very painful. Is it painful? Is that something they complain about?
No, not at all. This is in the realm of the surgeries that I perform. This is one of the more minor procedures as far as pain is concerned, and also the amount of technique that's involved. So, no, not at all.
Now, for people that don't know about your practice, you guys call yourselves the Dream Team.
Yes.
Why is that?
Well, because there's two specialists, my wife, who's a periodontist, Yetta McCullum, and myself, who is an oral and maxillofacial surgeon, and Dr. Robin Ferguson, who is a well-trained restorative dentist.
So she does veneers and all of those
She does
things.
veneers, correct.
Okay.
Exactly. The one thing we are missing is an orthodontist and a root canal specialist, but other than that, we consider ourselves performing high-quality work, so that's where the Dental Dream Team came in, and we're all under one roof. We're not in separate
That is
practices.
unique. Is that right?
Yes, it is. We actually started this dental dream team about 10 years ago. I'd say 10 to 11 years ago. And it's funny that now over the years, we see other practices also transforming and bringing in. Yes, exactly.
And do you think well, number one, people don't like going to the dentist.
Correct.
Right? I mean,
Correct.
especially the oral surgeon.
Correct.
They're really afraid of you guys.
Correct. They come
Is
in
that
all the
right?
time. Correct. They come in all the time and say, you know, I don't like being here. I don't like you people, but I have to get this done.
Is
Correct.
that right? And now your wife says that they end up liking you guys.
Right. When they're finished with the procedure and they're walking out the door, they say, you know, I hope I don't have to see you again, but if I do, I'm coming back here.
Is that right?
So, yeah.
Okay, good. Now your background and training, you know, great background. I guess you did your undergrad at Yale.
Yes.
You played on the football team at Yale.
Yes, we won
Tell me about that.
We won 3 Ivy League championships while I was there. So it was one of the better tenures of Yale football.
What was your position? What did you play?
I started out as a wide receiver, but at that time the offense didn't use wide receivers a lot, so I was transformed into a cornerback or a defensive back to utilize my speed. So.
Okay, so captain of the track team at Yale?
Team, yes.
All right. Now, when did you know you wanted to be a dentist and then an oral surgeon? And you have a medical degree, is that correct?
Yes,
as well?
correct.
Okay.
I thought about dentistry coming out of high school. My father kind of put the thought in my head that you want to be your own boss. He was a career military officer. He had gone to West Point.
Oh.
And so every year growing up, we moved someplace different. So when I was going into 10th grade, I was going into my 10th school. So the thought was, be your own man, make your own hours, move when you want to move, hire who you want to hire. And at that time in high school, I needed braces. So I was going to the orthodontist once a month, and he was paying that bill. So he thought that might be a good profession for me to consider, and I was open. You know, at that time, I wanted to be a professional football player, but dentistry was going to be my second option.
Okay. And you love it? Do you find that you really like it now?
Yes, I do. I don't think I would have liked orthodontics if I had stuck with it. I found out in dental school that I wasn't too good at bending wires.
Okay.
So the surgical medical aspect of surgery, of oral surgery, kind of drew me more than orthodontics. So that's what I gravitated to.
All right.
And I'm glad I did.
You don't seem like an oral surgeon, by the way. You don't act like one. And I don't know what one's supposed to act like, but did people
That's
tell
what
you
a lot of restorative dentists say when they meet me. So
Okay.
I won't go down that road. So.
All right. All right. Okay, so back to the denture wears. Okay, so we're talking about dental implants.
Yes.
Okay, so what are the options for denture wearers?
For denture wearers, there's a couple of options. One is to stay with their current denture,
Okay.
which a lot of patients don't want to do. They're looking for something different, something that will give them more retention. Their denture will fit more sturdy, something where they don't have to use adhesive. Patients, along with that gooey, creamy feel in their mouth, they're also swallowing and eating adhesive. The gagging that sometimes occurs with wearing an upper denture, the uncomfortability
Okay.
of a denture, the embarrassment sometimes with the clicking or the clacking or the denture becoming loose. Did I mention swallowing adhesive?
Yeah, they just don't like that. So with the
Yeah.
denture wear, you say with just 2 implants, you could change everything. Tell me about that.
Yes, 2 implants. Let me show you this model, Randy.
All right.
On the model here, we have 4 implants, 2 in the front, 2 in the back. But as a minimum, a denture wearer would need 2 implants in the front.
Okay.
This would make a world of difference compared to their current
So just snap
denture.
in, snap out.
Correct. 2 dentures right here in the front. The denture snaps in, it snaps out.
They can eat.
They can
chew.
eat. They can eat much better than they are. It's not the most ideal solution, but it's definitely a step in the right direction.
Okay. Okay.
4 implants would be even better. 2 implants in the front, 2 in the back. The
And
denture has
snap
more
in, snap out.
retention. It can snap in and snap out, or it can stay in permanently. The benefit of that is they can clean well around the implants. They can see what they're brushing and cleaning. Or the other option, which is kind of a higher end option, is a denture that goes in, it's screwed in place
By you.
by me or Dr. Ferguson.
All right. All right.
It stays in permanently, and they're taught by the hygienist how to clean well around
so
it
a
at
full
home.
arch of teeth with just 4 implants.
Or full arch of teeth with just 2 implants.
Okay.
Either or. So you have your options there.
So when I hear you say things like no more dentures,
Correct.
is that the future? of dentistry where dentures, as we know them now, will always be kind of fastened onto implants? Do you think that'll happen someday?
I smile because you say, is that the future? And I look at my history of practicing, and I'm saying, yeah, actually, that was the past 5 years ago.
Okay.
So yeah, that's kind of the past, the current situation, and the future as we know it. You know, of course, I can't predict what's going to happen down the road or what's going to be invented, but right now, permanent dentures that stay in are what people want and desire. If for some reason it doesn't fit into their budget, then they go to the removable, but the denture is supported by 2 implants or 4 implants.
Okay.
And it makes a world of difference.
Now the upper. You brought
The
upper. You say people
Yes.
don't like the upper.
The upper.
Upper dentures. I mean, they don't like upper dentures.
Correct. I brought a model just to show this is a conventional upper denture. So this is what people have been wearing for decades to centuries.
All right, all right.
This model is an upper denture. You can see the palate here. This is the part that covers the roof of the mouth.
Yeah.
Patients don't like this because they can't taste their food as well. It covers part of their taste buds. The gagging, sometimes it reaches too far in the back of their throat, and they feel like they're gagging when they're talking or when they're chewing. Sometimes they need adhesive to hold it in place because the bone has melted away over the years. While teeth are missing, while they've been wearing a denture, the pressure of that denture melts the bone away even faster.
Okay.
So adhesive is used to help support that denture in place. So patients kind of they just get tired of this. You know, after 10 years, 20 years of this, and now they know something is better because of the internet.
So what can you do then with dental implants for the upper?
For the upper, same thing as the lower, except 2 implants is not the solution because of the quality of the bone of the upper.
Okay.
So 4 implants is a minimum for the upper.
All right. Okay. And backing up, because you brought another model, for people missing 3 and 4 teeth and have removable things in their mouth. Why dental implants?
This is a partial denture. You can see the metal lines the inside. There's clasps or hooks on the outside of the denture. These clasps hook onto supporting teeth, other supporting teeth, that eventually are worn down or loosened, and something needs to be done. They either need periodontal treatment by my wife, or they need to be removed, or they need a root canal. But it causes a domino effect or snowballing effect of losing other teeth. It's a quick fix. It's an inexpensive fix, but it's not the most ideal situation. And a patient still continues to lose bone, so somewhere down the road, they need something better.
They end up losing their teeth.
Correct.
So dental implants, no more dentures, get a fixed set of teeth, and it doesn't have to be painful.
Correct.
It doesn't matter if you're 80 or 90 years old.
Correct.
You still qualify. Now, does it cost more to go to an oral surgeon?
Then
Because I guess a general dentist could do
can do the
implants?
same. No, it doesn't cost more. I think all our prices are all in the same ballpark. You know, of course, it varies from what part of the country you live in, but they're all in the same ballpark.
Now, you know, people always ask us, you know, wellnesshour.com is not a referral site. And I'm not trying to side with you here, but people ask, who should I go to? And I always say, go to a specialist.
Correct.
And so with all things being equal, and if it's about the same price, why not go to an oral surgeon that's doing this, right? I mean, is that how you feel?
Do you want my biased
Yes,
opinion
yes,
on this?
yes, I do.
Okay. Oral surgeons are trained for an extra 4 years after dental school in all types of surgery. So one thing, whenever anybody's having any procedure done, anywhere on their body, their mouth, their face, complications can arise. And you want someone who's well trained to be able to handle those complications, because you never know. So that's where my bias is towards oral surgeons.
All right, so do they need a referral to see you on dental implants?
No.
They go you to directly?
They come, yes, and especially with the internet and with websites and marketing on the radio and newspapers now, people do come to us directly.
All right, good. I want to thank you for coming on the show. Very interesting.
Thank you very much.